involves a big role and comes from the Children's Hospice Association Scotland, and I am going to hand over directly to Cian, who's going to take us through it. So round of applause.
Good afternoon everyone. My name is Cian and I am 15 years old. Today we are on behalf of the young people at CHAS. We are presenting a principle which states that planning and assessments should be made in a person-centred way. Our presentation is called Breaking Free.
Hello, my name is Scott and I am 18 years old. As you can see, we have a wall and within it we have 4 drawers. We are looking for volunteers that would like to come up and open the drawers. There is an object inside and you have around 10 seconds to guess what it is. Do we have a willing volunteer to come up and open door number 1? Don't be afraid. Do you know what the object is? Yeah, it should be under the rag. It's not that. It's that
I felt it, yeah.
Can you guess what it represents?
That's a book. The way of wisdom.
No, but what could the book represent?
The book could represent people's story.
But what it actually represents. And what it represents is education. And I would like to share with you my experience of transition with education. So you can sit back down. I went to a mainstream secondary school, but I felt that if I went to additional support secondary school, I would be more included. However, not attending mainstream secondary school really affected my confidence. As a result of this, I was nervous about the prospect of attending college. My transition to college was not straightforward, as I was about to leave school and I was still unsure about the courses I would access and what college I would be attending. I eventually managed to view 2 possible colleges and discuss my concerns. However, there were many things that I had to take into consideration. I did not want to attend a course just for the sake of it, and I wanted it to be something I was interested in. It had to have attainable goals. I also wanted to feel included socially. However, I was offered a place at college that I did not have access to the cafeteria for wheelchair users. And although there were health and safety systems in place for fire evacuation, there was only 1 member of staff who was trained to operate the equipment. My care package for support at college was not finalised until a few days before starting my course, and this caused me a great deal of anxiety. I was fortunate that I had someone who advocated on my behalf, and I am now studying a course that is suitable for me, which I know is achievable, and I am based on a building that I can access and with the appropriate support networks in place. However, I do feel that if I had person-centred planning in its fullest sense, so not only about service entitlement, but being fully supported to explore my aspirations, I would have been saved a great deal of anxiety.
Can we have a volunteer to open box number 2?
Blue rag. Red rag.
A syringe. Representing medical services, health services.
Principle 1 states that planning must be available from the age of 14, but until I started working on this project, I have never heard of the word transition in this context. I am 15 and I have not yet transitioned into adult services. My hope is that planning is going to happen soon. So with regard to healthcare and person-centered planning, I can only say that my experiences have been so far and what I would like to think will happen in the future. I feel that I have positive experiences with health care services provided. My mum is my support and agrees that my experiences have been positive and she wants this to continue, and I have transitioned into adult services. My hope is that when I transition to adult services, I am included in discussions with families that I understand. There would be no point in me having to ask my mum or carers later on what it all actually meant. My goal is that I attend appointments myself and have ownership over these discussions. I want to be as independent as possible and kept at the centre of my discussion. Would someone like to come in from box number 3?
So I think this represents having people to listen to you.
I'm not going to talk about social services, but Cassie is. However, she is quite shy, so she is going to do a presentation from behind the wall.
Hi, I'm Kelsey and I'm 15 years old. As this is a person-centered presentation, I want to talk about what is important to me, and that is One Direction. I was going to see them in Edinburgh, and my mum made sure that everything was in place for me to attend. It was really important that I had a changing edge with Hospice that I could use before the concert. So my mum contacted everyone involved to make sure that it would be available. The big night came, and as you can imagine, I was really excited. When we got to the changing room, everything was there that I needed, but the hoist was not charged. This meant a long delay. I did eventually arrive at the concert in time to see the last half hour. I was really distressed, and my big night was a complete ruin. What I would want to say is that it's great to have everything in place, but don't just accept that because it's there, it works. Everyone needs to be working together to ensure one good plan. There needs to be good communication. This has not happened between Muddyfield and the company providing affordable changing place, so the plan failed. On a positive note, Muddyfield are in the process of installing a changing place, and I have been invited to come along to its official opening. So remember, I love One Direction. I would also love One Good Plan.
Hello, my name is Kyle and I'm 17 years old. Can I have a volunteer in the audience to open box number 4?
Number 4. Oh my goodness. I don't think I want to take this out. I see the hand there, a real hand. Believe me, I did. Rocking horse. I'm not sure what it represents. Any ideas? There you go then. I'm not keeping this, I'm going to put it back in the drawer. I'll let everybody else just kept it here and a syringe. I'm not sure what you're going to do with that.
So does it actually mean you're growing up from childhood to adulthood? Could that be a possibility?
Yeah, that could be a problem. I'm finding it difficult to hear you actually. Anyway.
You're saying over here, is it maybe the transition from being very small to adult?
Oh, right.
The emotional represents the third cycle.
Thank you.
I have had a positive experience with transition so far. In particular, my school have been very supportive, and I attend college one day a week in preparation for me attending full-time next year. Therefore, I'd like to speak about my experience with CHAS. As you may already know, CHAS now have a transition policy within which there is an upper age limit of 21. We are concerned about what is available for young adults with palliative care needs, as these needs are very specific. Therefore, our plans and assessments have to ensure that these needs are met within a person-centred approach. However, we are apprehensive about what services are available within our own communities, in particular with regard to respite services and support us effectively. We have goals and wishes for our future, and for person-centred planning to work in its fullest sense, these goals and wishes need to be achievable. Can anyone guess what our drummer symbolises?
The drummer.
You get the chance to bang your own drum? You play your own drum?
It represents advocacy. According to Principle 1, advocacy should be available from the start of the transition process. We want our voice to be heard, but sometimes we need someone to bang the drum for us. CHAS have broken a barrier by introducing our policy. We need your help to have our voices heard and continue to break down many barriers which we face in our future.